So please watch this video. I want to talk about my diagnosis, my self-diagnosis of mental health problems and my diagnosis officially, and give you a tiny bit of insight. First thing I want to say is I believe I have a rare condition that is extremely rare for mental health problems and mental health hospitals, but exists, and there are other people with the same condition as me, and this condition involves psychopathy, but not narcissistically, more martially. Like, I take medication every day to help me with my anger issues, my depression, my mood disorder that is related to compulsive post-traumatic stress. I believe I have compulsive post-traumatic stress disorder in a mood sense, which makes me even like semi-theoretical, because my mood, it's not because I can't control my speech, although I can't sometimes. It's because of my mood, which is related to my compulsive post-traumatic, my complex post-traumatic stress. And when people blame my illness or my presence on cannabis, drugs and alcohol, I can't understand it. They've diagnosed me with cannabis-induced psychosis, schizophrenia, bipolar, schizoaffective disorder. Now I've got a little bit of all of those things within my illness, but it is none of them. It is none of them. And cannabis and drugs and alcohol are the best thing that ever happened to me. And yes, I need my medication. Why do I need my medication, my antipsychotic medication? Because it's tranquilizer, and it tranquilizes the mind, and it numbs the pain, just like cannabis and drugs, which is not what my illness stems from. When I was born, I had flashbacks and nightmares of being in my mother's womb. I don't want to go into anything else regarding my life, but I will carry on about my illness because it's interesting. When I'm unmedicated, I rant. I don't just rant. I say the most sickest evil things, and I can barely help it. But it's martial. It's martial, not narcissistic. And I don't mean to hurt anyone. But if anyone reacts to what I'm saying in a violent or intimidating way, I will defend myself however I see fit. But that is my illness. And yes, it is a mood disorder. And yes, it is all to do with trauma and stress. And that's why it's a martiality. It's like psychopathy, I think. It's like a mood disorder as well. And it definitely stems from having compulsive post-traumatic stress. Now, I started with this illness at about the age of 17 when I was homeless, and I was being used by sex workers for gratification. When I was 17 and homeless, like old women sex workers were using me for gratification. And that is not the only absurd sexual things that have happened to me at all. But yeah, and obviously I grew up as like a semi-mercenary gang affiliated and member, and yes, I am in need of medicine, and I probably will be for the rest of my life. But the best thing that has ever happened to me is cannabis, drugs and alcohol. Nothing better has ever happened to me, and everyone blames my illness on drugs and alcohol, but it's not true. So I can't believe it when they tell me I've got schizophrenia caused by cannabis, when I've smoked more crack than I've smoked cannabis and drunk more alcohol than I've smoked cannabis. I can't believe it's got anything to do with cannabis, but cannabis is the best thing in my life right now, apart from my dog and my apartment. And yes, they need to come up with a name for this illness. Where I'm from is not a common place. It's a bit too... My roots ain't common. My roots ain't common. That's all I can say. Where I'm from may have changed and be a common place now. But my roots, my personal roots are not common. And there were a few people in my city and that were raised in the part of the city that I was raised in that have the same illness as me, but it is extremely rare. But it would be nice to have some clarification on whether people would believe me.